Hi, my name's Annetta, and I'm a registered nurse. The reason why I chose the career of nursing is at the very young age of just 17, I had a baby. And I just had graduated high school. I didn't know what I wanted to do, what college to go to, what career to choose. And unfortunately, my son, after birth, had to be in the neonatal care unit, the NICU. So, as a new teen parent, naturally I was scared. I didn't know what to do, I didn't know what to expect. And I can't tell you how much I appreciated the nurses that took care of him in the NICU. I felt like they were really caring, they compassionate, they really wanted to um, talk to me and educate me and made me feel like they cared. And so I decided that after that, I might want to go into nursing myself and pass on the same type of caring love that they gave me. Um, so I started to go to school. I first became a CNA. And then I went and became an LVN. And as I was working as an LVN, I started school right away and decided to get my RN degree. So I went strictly and quickly from one program to another because I knew that my end goal was to be a registered nurse. After I got my nursing degree, I worked on the telemetry floor. I did that for about a year, and then I transferred to the um, cardiovascular ICU. And I loved it there. I thrived, and I still do. It is mentally and physically exhausting, and it can be a very love hate relationship on a day to day basis. It is not easy, it is not for the faint of heart. As you see the very sickest of the sickest patients, you see death, you see happy tears of patients who you didn't think would survive and transfer out of the ICU and come back months later and come visit and be thankful for the care that you gave them. But I guess the single most rewarding aspect of my career as a nurse is that knowing that at the end of the day, I did the best that I could for someone who is probably having the worst day of their life. These patients can be scared, especially now with the pandemic going on and no visitors being allowed in the hospital. The COVID patients, especially, and others, with any type of disease process in the ICU, they're alone. They're scared. They don't know what to do. All they have is that nurse who is working with them for the day. So, knowing that, I want to make sure that I'm there, that I'm holding their hand, that I am giving them that compassion and the care that they need and they deserve, and I treat them like they are like my own family members. So, words of advice that I would give to anybody who's looking into going into nursing is go for it. Don't do it for the money, because I'll tell you what, as much as people think that nurses make great money, and it's not terrible money, if your heart is not in it, you will not be a happy camper. Be compassionate. Like I said, treat them like you would want your own family to be treated. Um, it is easy to become jaded at times. You see things that you will never unsee. You hear things, you smell things that you will never unsmell. But that's just how it goes. But just remember, don't become jaded. And if you feel like you're becoming jaded, you can always switch departments. You can always switch careers. Like I said, I started in the telemetry. I went to ICU. I still work in the ICU now, just part time, and now I'm full time in electrophysiology, which is a very up and coming field of treating different heart arrhythmias, putting in pacemakers and defibrillators, and it's the up and coming field, and it's just gonna get better and better. What other advice can I give you guys? Remember at the end of the day why you went into nursing. When you are becoming tired, when you had the worst shift of your career that you can think of, remember it's okay. It's okay to cry. It's okay to cry with the family. It's okay to cry with the patient. Be professional. And just remember why you went into nursing or why you wanted to go into nursing in the first place. Nursing is really versatile. The career opportunities are endless. If hospital is not your thing, you can do home health, you can do school nursing, you can do so many opportunities. So just remember that. If, like I said, you will find your niche once you get there. It is a tough road in school. I think nursing is probably one of the hardest careers to study. Their demand on you is unexplainable. You will cry. You will, you will find your buddies, your study buddies, and just support each other, lean on each other. Remember to persevere and stay focused, because at the end of the day, it's worth it. I guess the other last thing I would say is apply for scholarships. Scholarships are available, grants are available. Even every little bit counts, even if it's $100, $200. When you're in school, you will probably not be able to work, maybe work part-time, and every little bit of that money will count. So anyway, just remember what you came in here for, what you wanted to do, and be that nurse that everybody aspires you to be. Don't eat your young, because that's just not the culture we want to foster. And the more you are knowledgeable, the more knowledge you can spread to others. It's just a great field. So good luck, guys.